Right, good afternoon to you. Welcome to the program. It's Good Afternoon Ghana, and my name is Ania Fompof. We'll be going through a couple of issues this afternoon, in two main sections. The first one, we're dealing with environmental and health impact of what we have termed Galamsey in the country. Of course, that's illegal mining. There's a lecture that's coming up about this activity. We're talking about the particular lecture schedule to discuss these matters. Also, what we hear is in the camp of the MPP, Alan Kojo-Martin, who stepped down from the flag bearership race some days ago, or say weeks ago, is addressing the press this afternoon, and we're picking bits and pieces of information of either he's, quitting the party, setting up a new party. What exactly has he for us? We'll take you live to the hotel where he is, and then the reporter Shadrach Odamiajari will come through with updates of what this man has to tell Ghanaians who see the future of a curve that he's taking. My name is Ania Fompof. We'll take a break. When we come back, we'll start talking. All right, you're welcome back. Let's now get talking. And we're dealing with the first part of the program, which I earlier on mentioned, that we're dealing with the impact of Galamsey, what we all know, or we have popularly been calling it, and that's the activities of legal mining. I think it's obviously not ending anytime soon, because we are in the cyclical mode of both political, leaders and the activists themselves who are involved in the activity. So it takes maybe one discussion and lectures after the other to see how we're going to go through. Now, there's a program that's coming up, and actually it's about environmental and health impact of Galamsey. So this afternoon, the person that I'm dealing with, or I'm dealing the issue with on this program is Dr. Grace Lovia Alote Babington. And she is a pharmacist and a senior lecturer, Department of Pharmaceutical and Microbiology, University of Ghana. You're welcome. Good afternoon to you. Thank you for joining us. Also, Dr. Frances Dennis is a senior lecturer at NMIMIR.
Yes.
That's Noguchi.
That's Noguchi, yes.
Thank you so much for joining us. Is that Noguchi's uniform? Or this
University
of Ghana?
This is our anniversary.
If I get it wrong, they will finish me. Anyway, you're very welcome. So let me just give you, maybe introduce this person just so you know a bit about them. Dr. Grace Lovia holds an MSc Pharmacy from the, Piaticos, yes. Piaticos State Pharmaceutical Academy. Okay, and also Russia, and MSc Pharmaceutical Technology from the King's College, London. And she also teaches principles of pharmacy theory and practicals. And then she's currently involved with drug analysis studies to determine the quality of amoxicillin and clavulanic acid. Is it clavulanic acid? You're right. It's not easy. Acid formulations found in the central region of Ghana. Now, she also has a publication on the study of ointments on the Russian and Ghanaian pharmacies, and the development and standardize of hydrophilic-based ointment for the treatment of ulcers. Oh, that's nice, right? Like, finally. Published. Is it internal ulcer or outside ulcer? External. Okay. Published in the 5th Russia Scientific Progress People in Medicine, People and Medicine. And also about Dr. Frances Dennis. He's a research fellow at the Noguchi Memorial Institute for Medical Research, University of Ghana. And also Dr. Frances Dennis is a research fellow in the Department of Electron Microscopy and the Histopathology, Noguchi Memorial Institute for Medical Research, University of Ghana. He's also a member of the African Rotavirus Surveillance Network and a core staff of the West Africa Regional Rotavirus Support and Training for, Rotavirus Reference Laboratory.
Yes.
Okay, reference laboratory, where he has been providing technical support for the training of rotavirus surveillance within the sub-region. For the past few years, he has also served as the RRL Ghana focal point. What's that?
So it's just the regional reference lab.
Oh, a regional
Yes.
reference lab.
Yes.
Okay. For the Ghana, for the global pediatric rotavirus and diarrhea surveillance network, contributing to the efforts of estimate etiology, specific burdens of diarrhea, hospitalization, and death through the Sentinel Science Surveillance Network. Hey, so small biology about you people. Everything is scientific. Why?
You're a scientist.
Anyway, you're very welcome. You're very welcome.
Right. Thank you so
Firstly,
much,
let's talk about the program. The program is coming off when?
Yes, so it's coming off this Wednesday, the 27th of September at 4 p.m. It's at the British Council Hall.
Okay. Now, let me go to the lady. Dr. Grace, why this program?
So the College of Health Sciences organizes biennially public lectures to educate the general public and our stakeholders on present health issues. And this is one of them. And our focal point this year is on Galamsey.
Okay. So I wanted to get the picture clear. Now let's get into it. Recently, Dr. Randy interviewed one, I think I've forgotten his name, I remember, something. Yeah, an old colleague of his who had done a research into Galamsey activities and the effect it was having on pregnant women and in childbirth, yes, and all that. And it was quite scary. So why that subject today? Still, let me stick with you.
I think this is the best time to talk about it. We, as the College of Health Sciences, we're focusing on the public health aspect of it. We have heard a lot being said about the environmental degradation. We have heard a lot about pollution, etc. But I believe we haven't heard so much about its effects on the public. And we have chosen this topic because we feel it is ripe. The data we are having, the clinical picture we are having, it just tells us that this is the time to talk about it and address it.
So give us a tip of this data that you have seen that made you, because for a reason or for some reason, I always feel that in this country, when the matter has, or the activity has taken place, and then effects starts showing, that's when we want to talk. But I feel we should start talking before the activity gets to a certain level for it to even translate into effects, right?
Absolutely. That should have, in fact, we should have started addressing this issue some 20 years ago. But we did not, and we still think the best time to address it is now. Because we are beginning to see the effect. And if you look at the theme of our public lecture, it says environmental and health impact of Galamsey, the real cost of the gold. So we want to talk about the cost of the gold we are mining. It is not the dollars we receive, it is its impact. We're beginning to see populations being affected. We're beginning to see children develop mental disorders. We're beginning to see pregnant women, the children of pregnant women being affected and being deformed. And we believe this is the time to engage the public, let them know, and also our stakeholders, so we can take measures to avert this disaster coming.
It's scary she talks about the fact that we should have started talking about it 20 years ago.
Yes.
So why?
Well,
We had Noguchi 20 years ago, or we didn't. Maybe I'm too young to know that we had Noguchi 20 years ago.
we did have Noguchi 20 years ago, but I think, like she says, the best next time to talk about it is now. If you look at what is called the iceberg principle, I think what you see on the surface is just a little bit, and there's so much beneath the surface.
So let me give you the iceberg. If you, growing up, you didn't watch Titanic, go and look for that movie and watch. Just go and look for that movie and watch. You know what the iceberg, is that where you picked the term from? Or is that
Well,
scientific?
it's a generic, yes, but it applies in that case as well.
In that case as well, okay.
Yes, so Well, like my colleague has said, there have been discussions around Galamsey. We've all seen the destruction of the environment, but that is just one aspect of the real cost that we are having to pay for the gold that is being mined this way. And so we want to throw some further light on some of the other aspects that maybe we haven't really averted our minds to. And that's what we want to discuss in this public lecture.
So what is it that we haven't really, is it about the health?
Mostly about the health.
Because we've talked, as far as politics is concerned, we've talked about the legalities and illegalities. We've talked about the distraction to the environment, the
That's right.
ecosystem.
Yes.
We've talked about the use of mercury in the waters. We've talked about water bodies that are, getting dried up and milked or mellowed up because of these activities. We're losing the water bodies and all. With the talk about mercury, it means that we've been talking about the health, or we are not seeing the picture clearly.
I guess maybe a little bit of detail into what really the challenges are will get everybody to sit up a little bit. The discussions about mercury, about the destruction of the water bodies, everyone just says we destroy the water bodies and we don't exist anymore.
Yeah.
Everyone just says mercury is toxic. But do we understand really the challenges that we are already beginning to see that maybe will encourage a relook and a rethink, about our approach to dealing with this matter? People normally would say, well, I live in Accra. I'm so far away from where this Galamsey thing is happening. How does that affect me? But like she mentioned, some of the effects, because of the agents that cause them, take a long time to see. And by that time, it's too late. Already we have started seeing some of these effects. We're talking about childhood development. The medics will call it cognitive development. We're seeing delays in speech in children who are exposed in these areas. We're seeing deformities in birth, because a lot of these agents that are being used are toxic. And what is normally not said is that a lot of these things, they build up over time, slowly. So the more that you're getting exposed to them, your body doesn't get rid of them. And so over time, it gets to a point where it's just so toxic to you. And then that's when we begin to see the trouble. But by then, it's too late. Everyone is just talking about we're destroying the environment. But even the people who are engaged in Galamsey, nobody is really talking much about them. But from what we understand, it's quite a significant population. And they are having their own health issues. All these will place a burden on the health delivery system. So these are things that we should start to think about. And the data that will be presented will help us to reflect on these.
Right. Dr. Lovely, I saw a video of two kids as young as 4 to 5 years, I think. One boy, one girl. And they were standing right in the middle of a pit, engaged in a Galamsey activity. I wept actually when I saw. I was going to post it on social media. By my mood, I just lost it. So I couldn't post. I thought that. But, it gets to a point where you want to draw the attention of people and let them know how serious this is. So if these children of this nature were not born with this situation, with a health situation from Galamsey activities, and they're healthy, but you find them standing, as where their mothers and fathers have been standing and engaged in such an activity, what is the likelihood that they can be affected? And as young as at their age?
So Galamsey has effects on the people working in the pits, as well as long-term effects. So for the miners themselves and those in the pits, the mining activity generates a lot of dust because they have to blast the core to get the dust. So that in itself causes a lot of lung problems for them. Most of them develop cancer years after.
Oh, years after?
Yes. Now, aside that, because the lungs are damaged, they are predisposed to a lot of diseases of the lungs, like tuberculosis, like silicosis. And these are severe infections that they may not fully recover from. Now, those in the waters, these waters are contaminated. They don't really have any convenient places.
I'm sorry not to really interrupt you, but on your screen is Alan Kojo-Tremating, who we were told earlier that he was going to give us a press conference. He has started. We're going to wrap up soon, and then we'll listen to him as well, so that we can bring you the breaking or the running story of his future in politics. So, okay, you land, and then we can.
Children in the ground and the minors as well are prone to a lot of infections. So that they don't really have any places of convenience. So these waters get contaminated. So they are predisposed to a lot of infectious diseases like typhoid, and these waters are standing. So any disease that is transmitted through vectors like malaria, typhoid, all those ones, they get it in the water. So these children are also predisposed to these ones.
Okay. So as we already told, just know that safe water is a global challenge, and 2.2 billion people are without water, let alone safe, and the impact of the staggering statistics. That also is a data that is there. We'll provide you more. But you'll hear more of this lecture that's happening. So let's just wrap up with that, so we can also hear the political hot cake who is, pressing on us to know his future. Again, let's know when the program is coming off, and then.
It's coming off this Wednesday, the 27th of September. It starts at 4 p.m. It's at the British Council Hall, and everyone is invited. We will be providing live streaming links, so they can check social media pages of the University of Ghana for these links to join us. We understand that the space is limited.
Okay. Oh, wow. Okay. I'm sure my bosses will work around it, because here at Metro TV, we are super passionate about Galamsey as well. So we'll be following through and see what will happen. All right. So Dr. Francis Dennis is senior lecturer at the Noguchi Memorial. And also we had Dr. Grace Lovialote Pabenton, who also came through, and she's also at the University of Ghana.